Our most interesting success story has to be a COPD patient, a 64-year-old woman that came in from Kansas. She had been diagnosed with terminal emphysema. She had a very poor prognosis, and obviously she had very, very little hope. Her husband was actually very, very depressed when he came to us. After her first treatment, we had done a small stress test, which is a variation of your average stress test. You take a 6-minute walk and we measure the distance that you could travel, how low your oxygen concentration gets, and she couldn't go past 3 meters in 2 minutes, and we had to stop. No more. When she came in, actually we had to help her out from a wheelchair to the hospital bed. It took her about 5 minutes to catch her breath. She was 100% dependent on oxygen, 24/7. Due to the nature of the disease, she couldn't care for herself in any way. She couldn't lift her arms to, bathe herself or do her makeup, do her hair, anything. She was, a little down in the dumps. After the first treatment, she came back. We did her stress test again, 6-minute walk. The first time, we actually made a slight miscalculation with our oxygen tank, and actually it wasn't open at the time, and she walked for nearly a kilometer. After that, we did it again with oxygen. She walked about the same amount, but no fatigue whatsoever. She did both tests within 5 minutes of each other. When we picked her up at the airport, actually, she came in. She was standing there waiting for us, no oxygen tank. After a while, we basically repeated the treatment. She went home, and we kept up with her through email. Turns out she's back to work. She went on a trip. She's doing her makeup, bathing herself, taking care of herself. She's taking walks. She's on a stationary bike 2 hours in the morning, 2 hours in the afternoon. Hardly ever uses her oxygen, just in cases of extreme stress, maybe once or twice a week. And this is a woman that went from not being able to stand on her own power or literally breathe without an oxygen tank to someone that's on her bike more than I am. Someone that's basically independent again. She got her life back. Well, as far as keeping track, what we do is we have our own baseline measurements. We get tests from the patient beforehand, and we'll run our own tests once the patient is here at the hospital to give a little comparison. And after the patient leaves, we obviously send a medical summary along with the patient for their own doctor. And we ask, obviously, that they have their tests repeated after a certain time, see if we show any improvement. Most of the improvement we're going to see, especially in COPD patients, for example, will be in their forced expiratory volume, which is basically how much air they can expel in the first second of a forced, blowing out. And usually we'll see a pretty large improvement, but also we'll have a CT to compare, see if there's any lung reconstruction. We'll see basically any changes you can really see will be mostly along the lines of function, but we'll also see some structural improvements. So basically there's a lot of follow-up. Our director, Dr. Lopez, is constantly in contact with our patients at least once a week. Most of the doctors are in contact with the patients also via email. And also the patients, in my experience, have been very good about getting in contact with us with the smallest doubt that they have, or just, to thank us, or, just keep a conversation going. We do build up a relationship with our patients.